My name is Alisa Manning. I'm a principal investigator from the Broad Institute, and I'm really happy to be highlighting an association between NIMHD's ScHARe portal and BioData Catalyst. We want to use ScHARe data in a BioData Catalyst analysis and show the research community how these two portals can interoperate. The ScHARe portal is a cloud-based platform for population science, including social determinants of health. ScHARe stands for Science Collaborative for Health Disparities and Artificial Intelligence Bias Reduction. ScHARe is a resource being provided by the National Institute on Minority Health and Health Disparities. And like BioData Catalyst, it's one of the NIH cloud portals that are available for researchers to use. So researchers register to use the ScHARe portal. I have a couple screenshots here that show what the registration process looks like. A user does need to have an account on Terra, or at this point in time, we could say a Google Cloud Platform ID or email that they can use on Terra, although we have expanded the Terra platform to use more than just the Google platform. The instructions here, provide the steps that you would need to use in order to register for the ScHARe portal. So this is done outside of ScHARe, but once you're given access to ScHARe, what we have is a workspace on the Terra platform that can be accessed from BioData Catalyst. So Terra works with projects in these entities called workspaces, and Terra has multiple programs that use it, like BioData Catalyst. So once you're given access by the ScHARe administrators to this workspace, any researcher can go in and read about it, and then most importantly, explore the exciting data on this resource. There are 316 data sets with area level and publicly available data about social determinants of health and other factors important to public health and human health. These data sets are in multiple categories. They have extensive documentation, including links to the data in the workspace and also data dictionaries. And then on the ScHARe site hosted at NIH, they have a data set document that has details on every data set. And since this is an amazing resource pulling together from data from so many different sources, there's the availability and opportunity to explore this data through the links and then context and information provided in the resource. So the ScHARe portal is pulling together all sorts of publicly available data sets. So there's no individual level data, it's not controlled access. These data sets can be used in public health research, medical research, and by linking the area level identifiers in your own data to any or all of the data sets in ScHARe. Of the many data sets, today we're going to be highlighting the use of the chronic disease indicators data set. So this is a data set that is released every year by the Centers for Disease Control of 124 chronic disease indicators important to public health practice. So the first level of documentation on this particular data set, you can see here on the right at the Centers for Disease Control and Prevention, we have a website dedicated to this data set with a data dictionary. So the information and context about the data that is in the ScHARe portal is available in a couple different ways. It's in the ScHARe portal, but then you can read the source documentation for the data set itself. We are, I'm showing you here one of the tables from their reference that it show the one indicator group of these questions. And Kavya, during the course of her analysis showcase, will use this question number 1.1, which is in the overarching conditions category, and is current lack of health insurance among adults aged 18 to 64 years. So we'll have a bit of more description about how we get to this data and use it in Kavya's presentation. I think what's important is that the data exists. We're going to show you how we linked the ScHARe data and specifically this chronic disease indicators data set to a BioData catalyst analysis that uses TopMed data, which is another NHLBI program, to perform a gene-environment interaction study where the environment that we're curious about in gene-environment interaction is brought by this particular variable, indicator variable 1.1, the proportion or prevalence of lack of health insurance among adults aged 18 to 64 years.